Yes. We know that if a person is over 65, has an episodic disability, and is not an Australian citizen, they are not eligible for the NDIS. There's also some services that will get swallowed up in the NDIS, making them unavailable for those who are ineligible for the NDIS. I would like to introduce the following panelists to speak on these issues. Right here we have Simone Allen, the NDIS advocate from Victorian Mental Illness Awareness Council. Jen Blyth from Deaf Victoria, who will talk about the National Auslan Booking Service, a government-funded medical interpreting service which is likely to be swallowed up under the NDIS. Lisimba from Action on Disability Within Ethnic Communities, or ADEC, of which clans are culturally and linguistically diverse. And we are also waiting for Henley, who is a campaign leader for the My Aged Care campaign for people over 65. So I'll start with Simone. What do you see as the biggest issues for people with episodic disabilities accessing support needs in the NDIS environment? And how are services for the non-eligible people being impacted?
Thank you for the question, Melissa. There is not enough evidence of the NDIS understanding psychosocial disability, episodic or not. The needs model does not promote recovery. How can NDIS be aligned with recovery? When someone is going through an episode, there is a plan and funding in place. Expecting a shift in the plan when things get worse isn't going to happen. Reviews every 12 months, episodes can be more seasonal and don't run to a calendar year. Yet they can feel recovered, but they are having to stipulate their worst case scenarios to get into the NDIS. We're concerned that the board of the NDIS has recently been reformed and there is now not a single person on the board who has been declared with a lived experience of disability. And how the services of the non-eligible people being impacted? We are definitely concerned that there will be a lack of services for people who are not eligible despite assurances that no person would be worse off. Mental health services are working very busily in an environment of uncertainty to try to be ready for the NDIS, but there is fear and confusion. There is confusion and there doesn't seem to be much information for people with psychosocial disability who are participants in the NDIS who turn 65 and then have to make a choice between staying in the NDIS or entering the aged care sector. Thank you.
Jen, can you tell us what the National Auslan Booking Service is and how it will impact on people who need medical interpreting but don't have an NDIS package?
Sure, thanks Melissa. NABS stands for the National Auslan Booking Service. It's a government-funded organisation. They provide interpreters for medical situations for deaf and hard of hearing people across Australia. So for instance, if you need to visit the doctor, the GP, if you've got an appointment inside of a private hospital, if you're going to a physio, the provision of interpreters is provided by this organisation for free across the nation. The introduction of the NDIS means it will have some impact potentially on the funding that NABS is allocated. So as part of your NDIS package, you would also have to incorporate medical interpreting costs. So that could have a major impact on the service provision of interpreters in medical situations, and specifically if you're over the age of 65. So it's very contentious and it's very uncertain as to what will happen moving forward. Does that answer your question, Melissa?
What are the biggest issues going forward for migrant communities in accessing services either in or outside of the NDIS?
I think because we do work with the people from non-English speaking background, and 50% of our clients are new arrivals, say somewhere between 5 years being in Australia to 2 or 3 years. Most of them are not eligible, or they don't have the necessary medical conditions or diagnosed, yeah, they do have a disability, but they not yet diagnosed in Australia to qualify for NDIS. But the biggest challenge for us as an organization also is to restructure the organization and divide the team into those who will lead us to transition to the NDIS and those who will still remain working on the block funding basis now. Just for short, the NDIS as the terminology itself is quite difficult for someone who is new in Australia or someone who is English not his first language. So what we do, we first go and do information sessions to tell the people this is an NDIS, this is a requirement, and this is a shift that is going to happen. For example, if your son or anyone from your family has a disability and has got an ISP, the new regulation is that that ISP is likely to be rolled over to NDIS. And we help with the pre-planning with that, but the problem is for those who actually don't have, who still don't have the ISP or DSR, it's a problem here.
Okay, a question for all of you. How are you currently supporting those who you know that aren't eligible for the NDIS?
I think, do you want to go with me first? Like for us, I guess those who are not eligible for the NDIS, like because we still got the block funding, so we navigate them through the services that are available. That's what we do. But the problem comes, for example, if the block funding stops, no longer block funding, and someone is not eligible for the NDIS, I don't know what will happen. I don't know what will happen here. So if anyone has.
I'm waiting for Lauren to arrive. What needs to happen for your group to access services outside of the NDIS, and what are the barriers to making this happen? Let's start with Simone.
Thank you. An assurance that there are services outside of the NDIS, where would that funding be coming from? And services and individuals focusing on getting ready for the NDIS, so how much attention is being paid to those not eligible?
Well, I guess what's happening with NABs specifically, one of the areas that is problematic, sorry, let me start again. Currently, we have aged care funding, and that's running in parallel to the NDIS funding. So we think that the aged care funding allocation should have been changed alongside of the NDIS, but that hasn't happened. And so that's problematic in itself. So at the moment, we're looking at how we can work with NABs and the aged care provision to make this work out for people who are over 65. But we think it really does need a collaborative approach. So if you're over 65, we want to make sure that you can get access to interpreters in medical settings. The barriers are obvious. People in government don't understand. They don't understand the issues that people with disability have. And I think that would be true to say of everyone in this room would have experienced that. So I think that education is key, teaching those government departments about disability and the issues that exist.
I think
What needs to happen for your group to access services outside of the NDIS, and what are the barriers to making this happen?
Look, I think I have a similar answer to yours. Because the NDIS, for the NDIS, I think for all of you here, has just rolled out in last July, and there is still a room for. There is still a room for improvement. So the key thing, as you mentioned, if the services, organizations that are delivering services, outside of the NDIS if they continue to receiving the services, and then also the advocacy agencies also continues receiving the block funding. I think there is an opportunity that people can raise submissions, and there must be some solutions for people that are not eligible for the NDIS. For us in terms of barriers, we do have as people from non-English background, the barrier happens two way around. For people to understand there is the services, and also for the services providers to understand that there are people that need their services. So these are the key barriers that are facing the people from non-English background. So what we are doing, we're trying to break that barrier and make the communication between the two groups easy.
Hi, Lauren.
Hi, better late than never.
Everybody, this is Lauren Henley, and she's here to talk about the My Age Scare campaign. So Lauren, tell us about the campaign and what are the biggest issues for this group right now in the light of the new scheme and the NDIS?
Sure, first I'll do my awkward blindy thing and find out where the mic is. So, all right, everyone hear me? Cool. Okay, so the My Age Scare campaign, it aims to do a couple of things. So first of all, it aims to advocate for equality of support for older people with disability who are ineligible for the NDIS. And it also aims to provide information and peer support to older people with disability who are ineligible for the NDIS. So most people will be aware by now that if you are 65 years of age or older when the NDIS rolls out in your area, you won't actually be eligible for the scheme. If you are already a scheme participant before you turn 65, when you turn 65, you can choose to remain in the scheme if you like. So this is causing a few different issues. And over 65s were told initially, when we were talking about an NDIS several years ago, that they would get the same level of support through the My Aged Care sector, or the aged care sector, but it's not happening, and there's a lot of issues. The largest one, I think, is access to information about what the arrangements actually look like. So the government's injected millions of dollars into projects that are designed to let people know what the NDIS is and how it operates and how people can get the support they need. But there hasn't really been the same focus on the needs of older people with disability. People are pretty confused about how to get the support they need, and they don't really know what their rights are or where to go to complain when their rights aren't being upheld. So as an example, one of the biggest differences between the NDIS and the aged care system is the level of co-payment. So you don't make any financial contribution towards your care and support needs if you're under 65 and in the NDIS. If you're accessing support through the aged care system, you're expected to make a co-payment towards your care and support needs. And there are protections in place to ensure that people can get what they need regardless of their financial situation. But the aged care space is so new to both people with disability as well as specialist disability service providers that we're seeing things go really, really wrong. So what we need to do is educate consumers about their rights so they can recognise when things aren't going the way they should and act accordingly. But there's also some workforce issues that relate to the very medicalised model of aged care services. Aged care services aren't really underpinned by the same social model of disability that underpins the NDIS. And we're seeing a lot of problems resulting from the fact that staff across the aged care sector don't really have the same level of awareness of the specialist needs of people with lifelong and severe disability. The other thing I'll mention is the waiting list. So we've had people that have been on waiting lists for the aged care system for 12 months and over, whereas with the NDIS, typically it's around a 3-month turnaround from when you apply for the scheme and when you actually get your supports in place. So there's some of the major issues that I can highlight at the moment, but yeah, happy to take any questions when we come to that later.
So, Lauren again, what needs to happen for your group to access services outside the NDIS, and what are the barriers to making this happen?
Yeah, look, I think there's a whole heap of things that we could talk about here. I think it's really inequitable. I mean, when we talked about the NDIS back when the Productivity Commission was doing its reporting thing in 2011, they said that an NDIS was supposed to cover the needs of people whose disability was not acquired through the ageing process. So if you acquire a disability after the age of 65, it makes sense to me that you should have your needs met through the aged care system. But if you were born with or acquired a disability early on in life, your needs are very different, and the way you view yourself as a person with disability is very different to someone who has lived a life without disability, turned 65, and then happened to acquire an age-related condition after 65. So I think there's some systemic work that needs to be done there, and the Disability Discrimination Commissioner is sort of backing that at the moment, along with the Age Discrimination Commissioner at a national level, which is fantastic. But in the meantime, I think it really is around educating people about their individual rights, making sure that advocates across the sector know where to go when people's rights aren't being upheld, and really trying to lift the quality of staff training across the aged care sector. So there's actually a review happening at the moment around aged care legislation, and people can have a bit of a say around what needs to change in that space, and the workforce strategy is one element of what they're looking at. So I think the consultation period closes on the 4th of December, so if anyone is keen to make a submission, then please do.
Okay, just a question for all of you. We'll start with Simone first. What can advocates do for their client if they have been told that their client is not eligible for the NDIS and needs services?
Support their client and appeal eligibility. Because it's a new scheme, especially in the beginning stages, we need to make sure that they're getting it right, especially as they are trying to limit their spending, and to reapply and appeal.
It's a little bit hard for me to answer that question, really. I think we don't provide service, but we are strongly aligned with advocacy work.
Okay, I just want to add to that. If a client comes to you needing medical interpreting and they're over 65 and they can't access it because of the way the NAVS is going, how would you approach that issue?
Okay, well, I know that NABS is committed to the interpreter provision for the next 12 months. VicDef have also agreed to support those in the age group of over 65. So I can't actually provide the interpreting service, of course, but I can help people advocate for ensuring that the provision occurs. And so really it's NDIS changes the system, and really it's the system that needs repairing. Yep.
Alpha?
I guess there are two kind of groups here. The ones that are not eligible, they're not meeting the requirements. So with that people, we're just trying to help them through other organizations that are still providing services outside of the NDIS. But because the overall system where we are in Preston is just rolled out a few months ago, so far we have done around 15 NDIS, so we helped them with the planning, and most of them were okay, just roll over were okay. But last week we did receive 2 internal referrals of someone whose NDIS has been rejected. And to be honest, because the whole NDIS system is new, I personally referred one person I gave them a contact of Social Security Rights Victoria. I hope of course they're here today. I gave them their contacts, and probably they're going to contact them. If not, then they're going to call us back. So what we're trying to do, if someone is not eligible, rejected, we help them through the process, but also we trying to refer to the people who are more experienced in doing the appeal. Yeah.
Look, it really depends on people's individual situations. So first of all, if someone narrowly misses out on entering into the NDIS because of their age, so for example, if they turn 65 in the same calendar year that the NDIS is rolled out in their area, there are early access provisions that may still allow that person to get into the NDIS. The legislation is incredibly confusing though, so may take a bit of a policy wonk to work through that in detail, and it is different in each state and territory. So first of all, if you have a client that you think fits within that criteria, may have turned 65 in the same calendar year, then I'd encourage you to explore that further. So The next thing, if your client isn't already receiving services, your best bet would be to try and support them to access specialised state disability support through state programs. But because some of these programs are now folding because of the introduction of the NDIS, you might still end up having to go the aged care route. If that happens, make sure you know how the rules of co-payment apply, and make sure you can go in and backfill your client around the co-payments to make sure they're not going to be financially disadvantaged. You can also assist them to access a hardship supplement if needed, if they can't actually pay for those co-payments. And there's some information on the My Age Scare campaign website, which is www.myagescare.com. There's a page that's called, I think the link's called Your Rights Regarding Co-Payment, so you can check that out and it will tell you what the basic daily fees are, how the negotiation around co-payments actually works, and that may be a good starting point in that regard. So next, if your client has a problem with an aged care service, you can try to resolve it with the service provider. You can refer them to an aged care advocacy service, and the one that operates here in Victoria is Elder Rights Advocacy, or you can support them to lodge a complaint with the Disability Services Commissioner. And if you still don't get a satisfactory outcome through that process, you can lodge a complaint with the Commonwealth Ombudsman. If your client's already accessing state-managed disability support services, they should still continue to receive support that's consistent with these arrangements. So the Department of Health is rolling out a new program called the Commonwealth Continuity of Support Program, and that's to make sure that they do receive the same level of support. It's a back-of-house arrangement, and what that means is that your client shouldn't actually need to do anything in order to be entered into the program. It should just happen automatically. And there are some providers that won't be registered to provide supports under the Commonwealth Continuity of Support Program. So if your client's service happens to be one of them, it's possible they may have to find a new service. The Commonwealth Continuity of Support Program doesn't actually kick off properly until next year, and it's similar to the NDIS in regards to how it's rolling out. So it's going to happen progressively over the next 3 years. And because of that, there's still quite a lot of unknowns. So what I would suggest is people really need to monitor the support they're receiving, and if it changes, they should seek advocacy support or perhaps take it up with the Department of Health, because the government's always promised that nobody would be worse off under new arrangements, and we really need to make sure that we hold them accountable for that.
Okay, so we've got about half an hour for questions, which is fantastic. So can I please have a volunteer to run the microphones before we start? Anyone? Okay, fantastic. So I would like you to raise your hand if you would like to ask a question to any of these panelists. Nothing?
Yeah, I'm just asking this question to Alpha. You mentioned that you already rolled in your organization 15 people. Is it interpreting part of the service at the moment?
Interpreting?
Yeah.
Look, we also provide interpreting services at ADEC. I'm just, to be honest, I just don't know the details how that works, but I'm pretty sure that we also provide, like before we use the standard interpreting services, but ADEC is now also providing interpreting services. And even we were trained. So for example, I can translate from English to other African countries, other African languages. It's my language. But there is a person that's responsible for that, the respite worker, and that interpreting services is a part of the services that ADEC delivers. I'm just not sure how that works, how the booking is being done here.
Okay, thank you.
Hi, it's Robin Gale from AFDO, Australian Federation of Disability Organisations. This question might slightly be out of scope, but I may as well ask it. When the NDIS was in its trial phase, there was a program that enabled clients who had a complaint with the NDIS, once they've got a plan in place, and that program was called the External Merits Review Program. Does anybody know if that program is now a part of the full scheme?
Yes.
Okay.
Yeah, so my understanding is, yes, it is part of the full scheme. There's a different advocacy organisation, or a couple in some states or territories, that have been funded to do external merits review, and it can just be as simple as someone going along to an administrative appeals tribunal hearing with an individual, or in some cases it can be more formalised legal assistance with a case. In Victoria, it's Rights Information Advocacy. Yeah, and I think they were announcing, there was going to be an announcement in October, I think, regarding what the arrangements were for the broader rollout. And I'm not sure if that's actually happened, but yes, the external merits review component, it is going ahead, and they've changed the name of it, but I can't remember what they've changed it to, but basically it's the same thing and it is still there.
If you turn 65 after your disassessment, will that matter?
If you turn 65 after your NDIS assessment, would that matter?
No, because, well, I would suggest not, because if you're having the assessment, then you're already deemed eligible for the scheme. I would assume that you would still get in. And there are those early access provisions I was talking about as well, so that if you only narrowly miss out because of the fact that you'll be turning 65 that calendar year, you should still be able to get in.
This is Alan Bartlett here. I'm not sure who to address the question of the panel, but in our transition to NDIS in Knox, we were informed that hack services were no longer available to people that were eligible for the NDIS. So there's a few questions. Does that mean if you put an application in, you get a knockback? Does that mean you're then eligible or not eligible? But it's just a total confusion whether people are still, so if we've put an application in and haven't got our funding, whether we still get our hack services from our local council. So I don't know which panel member would be able to talk about that.
Look, I've been doing a bit of scoping mostly in New South Wales, so I'm not sure if the arrangements will be the same here in Victoria, but I know in New South Wales, those state-based arrangements will remain in place for anyone who, for whatever reason, can't access the NDIS that does need that support. I've had conversations with Victorian agencies, and they don't seem to be able to give me a conclusive answer, or more to the point, they don't want to. But I would just monitor that, and if at any point things change, as I said, you're meant to be eligible for this continuity of support arrangement. So if you're getting specific disability services now, if you have access to those services now, I wouldn't expect that should change. And if it does, then I would encourage you to speak to someone about it as soon as possible. I'll look into it further.
Hi, it's Winnie Bridie here from Children and Young People with Disability Australia. One of the pieces of information that I think it's got on the NDIS website and various other places around when people are not eligible for the scheme is to get in touch with their local area coordinator if the scheme is rolled out in their particular area. I was just wondering if the panel has any comments or feedback or thoughts around that process and how that system is set up for people who aren't eligible for the NDIS. I'm
happy to speak to that, but does anyone else? Okay. So it's a bit haphazard at the moment. So local area coordinators are meant to be responsible for a very wide range of things, and part of their job is making sure that the needs of people who, for some reason, aren't eligible for an individually funded package under the NDIS are still met. So connecting them up with other services. What we're starting to see happen in the rollout sites, though, is because the NDIA itself is just really being swamped with requests and assessments and plans and all of those things, they've been outsourcing the planning to the local area coordination agencies, and local area coordinators at this point in time really don't have time to do anything apart from assist people with developing the NDIS plan. So while in the future, hopefully, they will be a really good point of contact for any person with disability, regardless of whether or not they're eligible for an individually funded package, to go and make sure they can get the information and support they need. That's not really happening now.
In the most recent quarterly report from the agency, they spoke about, I think, in rounded off numbers, it was around about 3,000 people were assessed as not being eligible for the NDIS. And in part, Lauren has kind of just answered my question, but I thought maybe we could explore it a little bit more. So 3,000 people is a lot of people. And that's people who have actually, who are in a region where the NDIS is currently rolled out, who have actually put up their hand to, have an assessment. So in terms of numbers of actual people with disability who may or may not be eligible, it could be even greater than that number. And you've all spoken a little bit about providing information to people about what their rights are in the event that they're deemed ineligible. But can we just speak about that a little bit more? And I'm particularly keen to hear from Simone, because with people, as you were saying, people with mental health conditions, it's not like you plan, well, hey, I'm going to have an episode next week, and because it's more convenient. And when you're going through an episode of mental health, the last thing you're thinking, mental ill health, the last thing you're thinking about is, so now how do I plan for this to be better next time? So can you just talk a little bit more about how and when you engage with people so that, especially in the event of them being deemed ineligible, but they've still got a condition that needs some supports?
I think we look at it case by case, and I believe when somebody's unwell, they obviously need support, and it is a problem that they won't be able to hopefully get their plan reviewed every 12 months, and in the episodic episodes, they'll need it obviously more. I don't know if I'm answering your question properly though. Sorry.
Well, I'm just wondering because I know that VMIAC is already overrun with doing your work regardless of any NDIS issues. So where do people go? Like where can we how can we ensure that people just aren't, staying locked up at home or out on the streets, not getting the support that they need?
Good question. VMIAC, we're obviously a small organisation, and we're ensuring that we provide services and advocates and education around the NDIS, and the mental health isn't being rolled out into the northeastern suburbs until May next year, and so we're really probably not going to see full extent of that until then. So
I'm finding it hard to not feel bleak, and so for people who are either having experiencing mental ill health, or people who are deemed ineligible, if they're not able to go to LACs because the LACs are overrun, and we're in a state of I don't want to use the word chaos, but disarray. Those 3,000 people plus, what can we, as in the disability advocacy sector, what could we be doing right now to support them?
I think that for us, as I mentioned before, like the process only 2 or 3 months is. But from last week, like we did receive few calls of people, the application has been rejected, and now we're just trying to work out where we know that on the website, NDIS website, there is a standard process of doing an appeal. But I know that there is also people that are more specialized, like the social security rights, which will be, and that's why I'm waiting for them actually to tell us later what will happen if someone's application is rejected. For those who are not eligible, I mean, depending, as you mentioned, from case to case, but in some way or another, they must be receiving some services at the moment. But the only worry that services may not be a long-term services, so that creates a kind of anxiety. But I think all these problems, like after 6 months or 1 year, we will have, as you say, 3,000 or 4,000 or 5,000 people who have a serious disability who are in need and there's no solution, and then something must happen.
I sort of wonder as well if we need to start pushing the envelope a bit with the local area coordinators. I understand that they're overrun, but if you have a look at the ILC policy framework that actually establishes what they're meant to do, there's specific wording in there around they're meant to provide one-off or low-cost access to services and supports, especially if it's for early intervention, or if not providing that support would have some sort of catastrophic effect on the individual. And so I think we need to be having conversations with the agencies that are doing local area coordination around, okay, well, what does this actually look like for our clients on a practical level? If someone's not eligible for an individually funded package, can we send them to you, and how can you help them? And it says in this policy document that you will help them. So what does that actually look like in practice?
Anybody else?
It's Kathy Barakas here. I just wanted to know what the group thought about health services like the Australian Unity and Mercy Health entering the NDIS support space. Is this a question for this forum for now?
Who would like to answer that one?
So was it about the organisations that are doing local area coordination specifically?
No, the private health providers like Australian Unity. I mean, we're talking about not eligible for NDIS. I mean, does anybody have a view as to what the future holds for those organisations when they enter the space?
I don't.
Sometimes you can't answer everything. So
Maybe somebody else in the room? Okay, we'll see how it goes.
Any other questions?
I suppose it's probably more of a comment, but it could be a question there as well. Melissa, by form, see my name. I'm an advocate from Gippsland Disability Advocacy Service. So just listening to the panel's conversation, our area, we have not received the NDIS has not come to Gippsland till September, October next year. So we still had a fair way to go. Within that, in the meantime, there's so many questions unanswered, from the diverse people that access our service, and some of those questions we cannot answer. We just answered by listening to other, areas that have already, the NDIS already rolled through. And one of the areas that comes up is always, what if I not qualified for NDIS? What will, happen to my, support, service? And also that we hear of a lot of tips, perhaps we shouldn't be talking too much to other people, and we're getting different feedbacks and give us, tips of what to do and the information to give to our clients and in preparations for it. And I just want to, to the panels, would they have any, tips or anything in preparation for us people, for areas like us that we are still waiting in preparations for it to come, so that we can, better prepare the client, the people that comes to us. Yeah. We often hear, they said, get your clients to have everything in order, be ready to, to apply, yeah, and have those things in place when they do get in the NDIS. It can be activated straight away. And if they don't have those other things in place, then it will, some disappointment, because it takes time to, put those things in place. So I just ask the panel, if you have any suggestions or any tips for us in preparation towards it.
Yeah, I'm happy to answer that question. One tip I have is keep asking questions. Keep talking to organisations who have experienced applications, have experienced the NDIS or the NDIA. Keep talking to people. Sometimes when you contact the agency itself, people don't know the answer to our questions. So keep asking questions, and over time you will find answers. I've been fortunate enough to live in the northeast of Melbourne, which means I'm eligible for funding myself. So I'm currently going through the process of receiving funding, as well as educating people about how to access the funding and the packages, as well as talking to people who have experience and what funding they've been allocated and what things they've got from their package. And so I think it's a continual learning process, and continual discussions need to be had. So I've certainly spoken to people who have been successful in their applications, and then myself experiencing that process. And so keep having conversations with all of those groups, and of course the agency itself. Keep talking. That's my number one tip. Keep the conversation going.
I've received a few questions from our viewers.
Okay.
Joy, did you want to say something?
No, I just wanted to say a quick one for you. I think I totally agree with her, but one thing also to take it back with you is to those who have a diagnosed disability, is to try to put a DSR with the department. So the applications get approved before the NDIS rolls out in your area. So if you have the DSR, then it's much easier for you just to roll over. I think it's just concentrate on your clients to get the documentations to put the DSR. Hopefully, that's the easy way, I think.
Yeah. Yeah, and I think my only comment is the NDIS aspect itself. Again, it's around making sure people know what their rights are. So, for example, if they don't have all their paperwork in order and they get a phone call saying, we want to do your planning meeting, they're perfectly within their rights to say, I'm not ready, can we delay it for a few weeks? That's fine. If they would prefer to have that happen face-to-face, they can also do that. And if they don't get along with their planner, or they're not getting what they need from their planner, they can ask for a new one. So making sure that your clients are really clear on what their rights are when they go into that process. And for people who may be ineligible, I would probably encourage them to start talking to their service providers now about, well, you know, I'm over 65 or I'm not going to be eligible for whatever reason. What can you do to make sure I still get the same level of support? And if people are getting a sense that their needs, their support may actually change, then, you know, that's the time when you need to start looking at things at a national level and talk to the Department of Health about this continuity of support thing, because if it's not happening, then we need to make sure we fight that, because it's meant to, you know, no one's meant to be worse off, is the bottom line.
Okay, we'll just received some questions from people watching on the live stream. One person has said, we are experiencing DHHS informing us that nothing will be offered until the NDIS rolls out. Our local region did not roll out in 2018. What can we do for our clients to ensure that they are receiving services until then?
What was the very first part of the question? Sorry, Melissa.
I said, we are experiencing DHHS informing us that nothing will be offered until the NDIS rolls out. Our local region did not roll out until 2018. What can we do for our clients to ensure that they are receiving services until then?
That one's a really tricky one, and one I hadn't really thought through, to be honest. So it's not something I have an answer to today, but I think it's what causes me quite a lot of concern. So I think as a sector we need to be looking to find an answer to that.
And the other one I received, how about all the families providing support that are now, hang on, let me read it first. Okay. How about all the families providing support that now want help and are told to wait? What about the DHS saying nothing will happen between now and rollout and to wait for the NDIS? People are missing out. I'm not sure how to answer that question either.
I know that there are, I was talking about early access provisions for over 65s. There are early access provisions for other people. If it can be shown that that person really needs support, and if they don't get that support in a certain amount of time, then there will be quite significant results. I think, yeah, there are early access provisions for people that are in those situations to say they can get into the scheme early. I don't know the ins and outs of how that's actually being applied. So there is a lot of policy that sits around it. And what's frustrating is there doesn't seem to be any point of contact that can answer those questions around these, you know, the early access provisions and how to make it work for your clients, because the NDIA, to my knowledge, doesn't appear to have those answers. So I think we need to be trying to find out what the answers are, because people shouldn't be falling through the cracks, and there are those early access provisions there for that reason, so that the people who need the scheme the most can actually get the support when they need it.
Sorry, I just wanted to add to that, because we've been trying to support people going through for early access, and we're having the same challenges of finding out where that point of contact is. But it's DHHS who have the final call, but the person needs to have a priority waitlisted DSR. So we're encouraging people outside of NEMA to call up constantly to get their DSRs priority waitlisted, so that if it rolls out the same in other regions, they will hopefully be put or get put forward first. But yeah, it's those priority waitlisted ones that are coming through now.
Hi, this is Judy Smith, and I work for Grampians Advocacy, which is for the most part, quite rurally based, and it has its own geographical challenges, as I'm sure many others in the room will be sharing, and certainly those online, because the very rurality is probably what stopped a lot of other people attending today. I've also been a teacher for decades, and in this entire process regarding the beginnings of something such as the NDIS has been absolutely astounding. This is exactly how you don't teach people how to do things. It's where you start off with a trialling process and then there's no absolute model that has been developed as a result of that. It's interesting because we're being observed internationally as to how we're setting this in place, and yet it is still, it's not even trickled down, because I don't believe that we necessarily have a model at the top that basically says let's go in this direction. So when I walk into my classroom of people who want to be future lawyers, teachers, politicians or jailbirds, whatever it may be, how do you teach from that basis? And to me, it is everything that you don't do. You don't tell them to go out and trial it. If you wanted them to learn quadratic maths, you don't tell them to go out and play with a few things until they come up with a theory. So here we are. And I'm an advocate, and I have double, if not quadruple, challenges that include rurality, where they can't even access the medical attention, they can't get the transport, my people are too unwell to send to specialists, etc., etc. I have people at the moment who are wanting things like face-to-face and they're being told to come to Melbourne. Are you real? It's not going to happen. And so, as an advocate, what is it that I basically want to be told to do, want to be directed to do? I want to have a really clear set of objectives from my people, and so I spend time and I talk to my people. What do you want to do? What do you want to do in 3 months, 6 months, 5 years, whatever it may be? Now, one part of my working area is already in the NDIS, and another part is about to come into it in January, and another part will move into it in October. So it's sort of like a set of steps. There are even cases where people are moving geographically to ensure that they can access it earlier if they move from one town to another. But where does that leave us? Unfortunately, it leaves us, I think, in a situation where it's all trial and error for us as well. And it's trial and error for us because we don't have direction from the top as to exactly how to do these things. And so we will do things like equip our people with carry around an exercise book or some sort of notation device where you write down every contact you've had, every reference number from every phone call, and you will get all of your notes in order, etc., etc. I'm sure we're all good at doing that. However, what do we then do with them? And so one of the things that I'm looking at is currently, across the 3 areas I work in, is the employment of the LACs and their staff. Now, the enormity of the responsibility, as has been mentioned earlier here by a panel member, is just overwhelming. Like, not only are they to set this entire process in motion, but they are to deal with what is left as a result of that, or the ramifications of it, and try and set up an alternative program for them as well. One of the calls is, should we be looking at some sort of review on the LAC, or should we be running a dual program? So in other words, we don't just have the LACs who take us into the NDIS, but they also run with a partnership program of those who fall between the cracks. I know that we are going to be employing certain organisations to take our people into the appeal process. So they're at 3 levels: those who are in clearly, those who are in the system, perhaps in the appeal system, and those who have clearly missed out. So to me, there are 3 prongs to this, and I don't believe we're getting the directions as to what we do with those 3 prongs, because the responsibility for this is sort of being handballed out into different areas. And it's a bit like the conversation from this morning about housing. When you've got 40 different organisations who are looking into how do you house our people in Victoria, it's running, to me, in a very similar basis. You split the job up into so many different areas that no one actually knows what the other person's doing. So on the positive side, we certainly have the moral compass in our direction. There would have been a smile on every face when the NDIS was given the thumbs up. But ultimately it comes down to money. And we can have all of the positive statements and enthusiastic advocates and so on as we like, but ultimately it'll be the dollar sign. So when 3,000 people are missing out, I think we have to be very, very clear on why they're missing out. Are they missing out because they don't have the medical evidence there, they don't have the disabilities, or there's just simply not enough money? And so in amongst our questioning, and I guess I've just thrown a whole fruit salad here into this discussion, but it's how I'm trying to perceive it at the moment. And I'm trying to sort out, how do I take my people through this? And I don't have any immediate answers, except that, as has been mentioned earlier, it is a case by case, but we are going to be dealing with tens of thousands of people. And therefore, I would like, if we have any capacity whatsoever, to be able to call upon even just the reconfiguration of either who do we contact in case of, and have a clear listing of that. Do we reevaluate the roles being offered to the LACs? I simply don't know how humans can actually do what it is that they are being asked to cover at any given time. I don't care what the money is, and they're not being overly generously paid as far as I'm concerned either. And the other one is when we sit down and we're just face to face with our own people and what it is that we tell them. To me, there has to be some way of bringing all of this together, and it is not clear at the moment. So my people, they will be coming to me on the phone, they'll be coming to me in the office, they'll have pieces of paper, they'll have their folders where they've been saving evidence and so on for 10, 15, 20 years. And then you factor into that the fact that now some people are going to be going into their 60s and 70s, and there is angst all around, not only from the clients themselves, but also from the people who work in the sector. Well, I guess all I can say is I reckon we should stay strong, but I think we need to be questioning the role division that is currently being enacted within the NDIS, and is it absolutely feasible? Because it's no use us continuing with a charade where it is simply not workable. We have really good people here. We have the moral compass in the right direction. We have some funding, but is it time that we actually need to be questioning, all right, who is ultimately making these decisions? Who fills out the roles for these people to live up to? And so where do we, the people on the ground, actually direct, how do we direct our people to get the services that they need? Thanks for listening to my rant.
Thank you for articulating that so well. I think I really love your idea in terms of restructuring the LACs, because I think the key problem for the over 65s, as I've identified, is information. There's a clear communication strategy around the NDIS, what it is, how it works. There's no communication strategy in terms of what you do if you fall outside of that. People are so confused and so scared, and they have no idea where to go. So I think at least if there was a separate little department that people could go to that actually dealt with those cases, that would help immensely. And the whole reason the My Age Scare campaign came about was because people were freaked out. They didn't know anything. They had no idea where to turn. And look, we still don't have all the answers, because I'm only one individual. I'm trying to sort my way through this information as best I can. I'm not a lawyer. I don't know the ins and outs of the legislation, and the government's making it really, really hard.
I just have a question. You know, the 3,000 people that are missing out, are they not those who are not eligible, or the applications that are rejected? Are they around Victoria or a specific area? You know, the 3,000 people that are missing out.
Thank you for the question. They're rurally based. Okay. They are underinformed. Okay. Because we are currently, within the NDIS, we are employing people to go around and inform. The problem is these people will go out and they will inform, but what they have to tell people is so limited. Yeah. And they can't, a bit like all of us, they can't answer all the questions. And in some cases, they're actually sending people out, especially into rural areas. They will be the only access of information, and yet what they carry with them is so incredibly limited. Not because they don't want to try and tell it, but simply because of the amount of information that is trickling down from the top. And therefore we go into the area of misinformation and guessing and making assumptions. So to answer your question, I believe it's the lack of information in the first place. I also believe it's the lack of medical evidence in some cases because of the rural factor. You're either waiting for 9 months for an appointment from the only surgeon who might visit that part of Victoria, or trying to get into something like particular clinical psychologist. I mean, how many of them grow in the country? Usually bring them on, but if they are there, God bless their hearts, but they will have a waiting list that is at least 6 months long. And so to answer that, I think there are at least 3 different reasons. I think it's the lack of information. I think it's the lack of medical evidence to back up their claim. Yeah. And the third one is, I think in many cases, it is the make, do, and oh my God, I'm going to wait till I get all this sorted out before I try it for myself syndrome. Yeah. Thank you.
Okay, we've got another comment, question/comment from one of our viewers. People have been contacting DHHS to register on DSR, but are being told they cannot register. A person I know was supposed to transfer a current package from New South Wales to Victoria, but told she can't.
Has that case actually been put to the Minister for Disabilities? Because I know they're very keen in that office to hear about the people who are falling through the cracks. So I wonder if anyone's taken it through that level yet, just to ask the question of like, what do you plan to do with these people who can't get an NDIS package for another 2 years or whatever, but really need support now? So I would encourage people to do that and actually write letters to the Minister where possible and try and get some answers that way.
Do you have any more questions before we break for afternoon tea? Nothing? Okay, thank you. We'll have an afternoon tea for half an hour, so we'll be back at 2:20 to start the presentation on DSP. Thank you.